today we're going to be talking to y'all about rib dysfunction, also known as costovertebral joint dysfunction. Our objectives, so today we're going to define rib dysfunction, what causes it, discuss the clinical manifestations, review potential functional limitations, identify tests and measures used for diagnosis, discuss differential diagnosis of rib dysfunction, outline rehabilitation phases and protocols, and discuss the expected outcomes. Alright, so what is rib dysfunction? It can be stated as misalignment or altered mobility of one or more ribs resulting in pain and functional impairment, and according to Dutton, they can be categorized as structural rib dysfunction, torsional rib dysfunction, and respiratory rib dysfunction. So for structural, you would have anterior subluxation or slipping rib, and posterior subluxation or slipping rib also. For torsional, you would have external rib torsion or internal rib torsion. And also, according to Dutton, it says that structural rib dysfunctions are true joint subluxations or partial dislocations that occur secondary to trauma, and these dysfunctions are extremely painful and significantly reduce motion of the ribs during inspiration and expiration. And most important landmarks for the structural rib dysfunctions are the rib angle and the anterior rib, and the ribs can sublux anterior or posteriorly, and also the first rib can sublux superiorly. And then torsional, as the name suggests, these rib dysfunctions are twisting injuries in which the rib is held in a position of internal or external rotation, and then these dysfunctions affect the thoracic spine motions as well as the motion of respiration. And for respiratory, the respiratory rib dysfunctions usually are related to poor posture and result in a restriction of either inspiration or expiration. So what could cause these rib dysfunctions would be trauma or injury, repetitive movements or overuse, poor posture or prolonged static posture, muscle strain, sudden uncontrolled movements, respiratory strain, and degenerative changes. So for direct trauma, it would be like, a fall or blow to the chest or motor vehicle accident, which would disrupt the normal function, or like a chest contusion. Repetitive motion involved in upper body, such as like certain sports or occupational tasks, they can strain the joints. Poor posture, obviously. Prolonged poor posture, especially in a slouch forward leaning position, can place uneven stress on the landmarks. Then muscle imbalance or weakness, where certain muscles will become overly tight. Then sudden uncontrolled movements, such as awkward movements or forceful twist of the torso. Respiratory strain, conditions that cause forceful or prolonged like coughing, that can cause a rib dysfunction. And then degenerative changes, which would be, of course, age-related or arthritis in the spine or degeneration of the joints. So for the structural rib dysfunction, as I previously stated, we have an anterior subluxation and a posterior subluxation. And for the anterior, it would be a partial anterior dislocation of the ribs connection to the vertebrae. And then the rib angle would be less prominent, the intercostal space would be tender, and then the thoracic findings were more prominent. This was located in the, of course. And then for the posterior subluxation, it would be a partial posterior dislocation of the ribs connection to the vertebrae. And then the rib angle is more prominent, the intercostal space is still tender, and then the thoracic findings are less prominent. And then for torsional rib dysfunction, we have the external rib torsion, which is a prominent rib angle and tender superior border. The intercostal space is wide above and narrow below. And then the anterior ribs are ipsilateral at the level above. Then for the internal rib torsion, the prominent rib angle and tender inferior border is noted. Then the intercostal space is narrow above and wide below, so it flipped. And then the anterior rib is contralateral at the level above. Alright, and then for our respiratory rib dysfunction, as I may have stated, but it wasn't on the slide, I said inhalation dysfunction and then exhalation dysfunction, which go into kind of breathing. So for the inhalation dysfunction, the rib or group of ribs that are affected are stuck in an elevated position or an inhale position, and there's a restriction of full exhalation, and the chest tightness and restricted breathing as a result of that. And then for the exhalation dysfunction, the rib or the group of ribs are stuck in a depressed or exhale position, and the restriction it restricts lung expansion, and then it hinders deep breathing.
So for the clinical manifestations, one common sign of this condition is palpable rib tenderness. And this particularly around the costovertebral joints. And this tenderness is often localized, but can radiate along the intercostal spaces. We also have muscle spasms in the surrounding thoracic musculature that are common and occur as a protective response to dysfunction. Patients may present with visible rib misalignment where one or more ribs appear out of place or less prominent than others, especially during respiration. And then additionally, we have abnormal rib motion during breathing, which may be observed, and this is where certain ribs are either moving too little or too much depending on the type of dysfunction. In cases of trauma or injury, swelling and or bruising may also be present around the rib area. And then the symptoms that may be noted by patients with this dysfunction include sharp localized pain, particularly during deep breathing. And this pain may radiate to other areas such as the chest, back, or shoulders. And patients may experience difficulty performing activities that require bending, twisting, or twisting, and pain is also increased by these movements. And then you have excessive pain that may occur with sneezing, laughing, or coughing, which is another hallmark symptom, and this can often indicate involvement of the intercostal muscles or nerves. So for the functional limitations, so rib dysfunction can lead to significant functional limitations, particularly in the upper body. So you may notice limited upper body movement, which may restrict a patient's ability to perform everyday tasks like lifting, bending, or twisting, which can significantly reduce their quality of life. They also may experience difficulty with overhead activities, such as raising the arms, which may increase rib and thoracic spine pain. And this limitation can also affect activities such as reaching for objects, lifting, or even dressing. Another common issue is shortness of breath during exertion, so as rib dysfunction can impair normal respiratory mechanics. So patients may struggle with activities that require sustained effort, such as climbing stairs, walking long distances, or exercising. And then finally, we have difficulty maintaining posture for prolonged periods. So rib dysfunction can cause discomfort and pain when sitting or standing for extended periods, particularly in patients with poor posture or sedentary jobs. And this can impact their daily activities such as working at a desk, driving, or performing household chores. So to diagnose rib dysfunction accurately, clinicians can use a range of tested measures. And so the first one that we can use is range of motion assessments, which are just critical in evaluating the mobility of the thoracic spine and the rib cage. Limited motion in these areas can indicate dysfunction, particularly when the patient has difficulty with full thoracic extension or rotation. Then secondly, we have palpation, which is another important tool, and it helps identify areas of tenderness or misalignment along the rib cage, and it can help isolate which ribs are involved in the dysfunction, as well as assess for muscle spasms or tightness in the surrounding musculature. Then we have imaging, which may be used when necessary, particularly if there is a suspicion of rib fractures, dislocations, or any other structural abnormalities. So x-rays are useful for identifying bony changes or misalignments, while CT scans help provide more detailed images of the costovertebral joints and the surrounding structures. Then we have special tests like the lateral and anterior posterior rib compression test, which can help assess the mechanical functions of the ribs with any pain that the patient may note, which indicates the possibility of a rib fracture, rib contusion, or costochondral separation. And then we also have the inspiration, expiration breathing test, which helps evaluate the movement of the ribs during respiration. So any rapid or shallow breathing and or pain that they have while breathing can also indicate a rib fracture. And these two tests are just essential for differentiating rib dysfunction from other conditions that affect the thoracic spine. So for differential diagnosis, we have two specific conditions. The first one is thoracic outlet syndrome, which involves compression of the nerves, arteries, or veins that pass through the thoracic outlet. This condition can mimic rib dysfunction, as patients may experience pain and discomfort in the chest and upper back. However, thoracic outlet syndrome is characterized by neurological and vascular symptoms such as numbness, tingling, and weakness in the arms or hands. So special tests like the Roos test, Allen's test, or the Adson's test are used to diagnose TOS by evaluating for nerve or vessel compression and rule it out against rib dysfunction. Then we also have costochondritis, which is another condition that mimics rib dysfunction, but this involves inflammation of the cartilage where the ribs attach to the sternum. So this pain is often localized to the anterior chest wall and is typically capable of being reproduced with palpation at the costosternal junctions. So unlike rib dysfunction, costochondritis does not usually involve rib misalignment or restricted thoracic activity or thoracic mobility. It is primarily a self-limiting condition, but differentiating it from rib dysfunction is crucial to just help ensure that we have the proper treatment for the condition. So for our rehab phases and protocols, so for the maximal protection phase, during this phase, our primary goal is to reduce pain and prevent further injury. So in this, the treatment's going to focus on rest and pain management using modalities such as ice to reduce inflammation. We'll also introduce gentle breathing exercises to help maintain lung function without straining to the ribs. And then patients are also going to be educated on posture and body mechanics during this phase to help avoid aggravating the condition. Then in the moderate protection phase, the focus is going to shift to restoring mobility and beginning functional activities. So in this, we'll do gentle thoracic and rib mobilization techniques just to help improve the range of motion. And then patients will continue with the breathing exercises that began in the max protection phase, but the intensity is going to gradually increase to promote rib movement without causing pain. And then we'll also introduce functional activities we'll introduce them carefully to prevent re-injury. Then finally, in the minimal protection phase, the goal is going to be to strengthen the affected muscles and restore full function. So we'll introduce strengthening and flexibility exercises that will target the core, thoracic spine, and the upper body. So the patient, as they progress, they can return to full activity, including sports or other high-level physical activities. And this phase is going to be critical for ensuring that the rib dysfunction does not reoccur and that the patient can resume their normal lifestyle. So likely outcomes. With appropriate treatment, the outcomes for rib dysfunction are generally positive. So pain and discomfort are typically significantly reduced as the underlying cause of the dysfunction is addressed. And then patients also may experience improved rib mobility and flexibility, which will enhance the overall thoracic function and reduce stiffness in the upper body. And then in terms of functional outcomes, patients can expect enhanced capacity for activities of daily living, ADLs, such as lifting, bending, and reaching for objects. As rib function improves, tolerance for physical activities and sports will also increase, just allowing the patient to return to their pre-injury level of activity. And then lastly, patients will also typically report improved respiratory function as restoring rib mobility allows for fuller, more efficient breathing. And this is particularly important for individuals with pre-existing respiratory conditions, as rib dysfunction can exacerbate breathing difficulties. So overall, rehab can help patients regain their quality of life and return to their normal activities with minimal risk of reoccurrence of this condition. So overview. So rib dysfunction is the misalignment of one or more ribs causing pain and functional impairment, and it can be divided into 3 subcategories, which are structural, torsional, and respiratory. It can be caused by trauma, poor posture, muscle strain, degenerative changes, sudden and uncontrolled movements, etc. With respiratory rib dysfunction, the ribs can be classified as stuck in either an elevated or in a depressed position. Clinical signs for this condition include tenderness and misalignment of the ribs, muscle spasms, abnormal movements of the ribs while breathing, and bruising and or swelling. An individual with rib dysfunction may also experience sharp pain while breathing, sneezing, laughing, or coughing, and this pain may radiate to other areas such as the back or shoulders, as well as trouble when the patient is bending or twisting. Diagnosis for this involves range of motion, palpation, specific imaging, and then other specific special tests that we talked about. Common differential diagnosis include thoracic outlet syndrome and costochondritis. And finally, with the proper treatment, an individual's pain can be reduced and their overall function can be restored. And these are our references.